Now we're back with this story on a 29-year-old Selangor resident from Shah Alam who have survived the COVID-19 infection after being treated at the Sungai Buloh Hospital last month. Nur Naqiah Jalaludin spoke to Nightline on April 7th from her hospital bed, and now she has recovered fully from the virus, just like the vast majority of people who catch COVID-19 who make a complete recovery. Exactly a month later, now she joins us again on Nightline, but this time from her house in Shah Alam. Hello Naqiah, welcome to Nightline. Now, the medical fraternity is still grappling with the mystery of patients who continue testing positive weeks after recovery. Now, doctors have informed you that you're able to go home after recovering completely. What else did they tell you when, you were discharged from the ward? Naqiah?
The doctors advised to still keep myself quarantined, actually self-isolate inside my house because I'm living with my family. And then they asked us to actually still monitor our symptoms in case we still have fever, ongoing fever or cough and everything. We have to call the PKD. They gave us this piece of paper with the quarantine notes and also the instruction of what to do and also the PKD number. So if let's say my health condition suddenly become worse, I can call this number and they will straight away attend to us directly.
Okay, now when we spoke to you last month, the fact that you were being hospitalized and, being away from work, and I believe you were a senior executive in marketing and communications. Now, how are you mentally processing, everything that you have gone through during this 27-day journey to recovery? And probably, can you just describe to me the state of your mental health, Naqiah?
For the first few days, and I actually had nightmares also, but right now alhamdulillah I'm doing fine. And around 9 to 10 days after I was discharged, I received news about my retrenchment. That time it was actually hard because it was related to career and also money. It took me a few days to actually recover as well and get back on my feet. So in terms of first one was health, and then that one is actually a bit more serious, but now I'm coping well. Also regarding news related to my job, also I'm adapting well. I'm doing something else right now. So, but I can tell you that the support from friends and family are really, really important.
Yes, I agree. Support from friends and family is really important. Now, each day, tens of thousands of new patients are testing positive for COVID-19, and thousands of deaths are being, reported around the world. Malaysia now plans to help other countries undertake clinical trials for the development of COVID-19 vaccine. What are your thoughts on this, Naqiah, especially on researchers, actively looking for volunteers?
Would I volunteer? Yes, definitely, because it is for the good of the other people. I would not want anyone else to go through what I went through. So yes, I wouldn't mind being a volunteer for COVID-19 research studies, because I myself would want to get myself vaccinated after this, once the vaccine are available, because I heard that recovered COVID patients are highly likely to actually get reinfected, if I'm not mistaken. So yeah, I'm a bit paranoid about that. So yes, I will say yes to any research or anything that government would like to do in order to protect everyone else. So yes.
That's lovely of you, Naqiah. We wish you luck on that. And also, we are really sorry to hear that you lost your job. We hope, there'll be something out there just for you. And thank you again, Naqiah, for joining us on Nightline.